Hi there, you okay?
Hi, this is Sharjil.
Yes, speaking.
Hi, Sharjil. My name is Mohammed. I'm with the GP from TIC Health.
Hi there, how
Uh,
you doing, Mohammed?
about you, okay?
I'm good, thank you.
Good, good. So I think I'm calling just to discuss the results of the scan that you did.
Yep,
And I trust you probably got the report yourself. Is that right?
correct. Let me open up the report that I received from your end. So this is for the latest one I've done, right?
Yeah, yeah, yeah. This was the one from June 6th, I think. Or, yeah,
Got it. Take care.
June 5th.
Yes, I'm ready whenever you are.
Yeah, basically, I mean, we could do it two ways. I mean, I can go through the report with you if you want. But I imagine you've read through it. Maybe the best thing that we do is you ask me the questions you have about the report. Things that weren't ultimately clear, or anything that you feel like you need a bit more advice.
So I, last time I spoke to one of the TIC Health managers, he said, he will get an investigation done because, the reports do not match. And there's a lot of discrepancies, especially not mentioning anything about my true conditions and what the radiographer spoke to me about. And he said he will investigate, and then today they will speak to me regarding that. And I was waiting for you to tell me today that you have compared both of the reports, that are done at Tech Health, and what you have found.
Yeah. So which part of the report do you think doesn't match, or do you think there's a discrepancy?
Everything about it is it doesn't mention anything about my organ failure that I'm going through. Both my kidneys, my liver especially, and the surrounding organs. There's no mention of it at all. The lymphs that the radiographer spotted at that time, which he mentioned to me straight away after the scan, and there's no mention of that either. And yeah, just sticking with that same story of a simple kidney cyst, which again does not does this to a person.
So in terms of like what doesn't match, it's more that it doesn't match with an explanation for the symptoms that you're having, rather than like it doesn't match the last
Oh,
scan that you
oh,
had.
I've been living with this pain for a very long time, and this is why I've you know got these scans done. And all my scans, my medical records have been fabricated to cover up my true conditions, the truth of my story, and everything I'm going through. Just silencing the victim. And again, I- I've got this scan redone at Tech Health, expecting this time we could catch whoever's behind. Getting this getting away with this, who's behind the fabrication of my medical records, who's tampering from the back end, generating these false images that is not my body. I've explained to you both my kidneys, my liver, and the surrounding organs internally are very, very damaged, and I'm unable to walk. I'm unable to get on with my life, and I'm doing everything I can to get my health back, my life back together. And again, the systems keep getting compromised. Even for you, I want to know about the investigations that you guys have carried out. Speaking to the radiographer and your team, what have you done about this?
Yeah.
Because I already discussed this with the manager I spoke to last time, and he said he will have this call will explain everything that you guys have done from your end.
Yeah, yeah, for sure. Yeah, I think so. Basically, what our manager did is that he had a discussion with the radiographer who did your scan, and that radiographer submitted sort of like a statement in terms of like what the experience was, what happened. Because I think the question was, and again, you correct me if I'm wrong, is that when you had the scan, he made mention of maybe something he saw, or he had some advice about what the next steps would be for you. Um, is that right? Is that what happened?
No, no, he just mentioned what he saw on his screen, knowing, I've told him about my poisoning and what to look out for. And for him, it was very kind of how, he spotted something, on the screen. Again, they did not mention anything about my kidneys, my liver, but lymphs out of nowhere. Uh, maybe they're there, maybe they're not. And like I said, my body is in a very bad condition, and him spotting these lymphs are that that hasn't been in any of my reports was a big change. And
Yeah,
after that, we had a discussion, we were speaking, and he said, what, they will make a note of these lymphs, and he's suggested a biopsy. If I get a biopsy done, we can get to the bottom of it. But yeah, there was literally no mention of any lymphs at all on your report um, that was provided to me.
yeah. No, I understand. I think it. I mean, we spoke to that radiographer, and he said that he didn't make any comment on the imaging appearances or give any advice about biopsies or any further investigations. I think it's difficult because our radiographers aren't medically trained. Like they're technicians who are specialized in being able to perform the studies, but not to be able to interpret them, not usually anyway. So that radiographer, it's not he wouldn't usually make those type of comments because he wouldn't know what he was looking at. To be fair, that's the same for me. That's why
That's fine.
I felt
His,
very much support.
that's fine. I understand his job is just to get my MRI scans done and then pass them on to you guys, who will dig deeper in detail and find out anything that's there. Uh, but have you compared both of my reports, both of my scans that I've done at TIC
Yeah,
Health?
yeah, exactly. And they're pretty much the same. It's again, is there something that you looked at in your reports which you feel like this wasn't mentioned before or this is different?
So, sorry, what did you say?
Sorry, I said from my end, the findings haven't changed between the two scans. Um, but have you read something in either of your reports that you feel like is different or wasn't mentioned on the previous scan?
No, everything is wrong. It's again, it's only what they want to show you, and what they want
Yeah,
to reveal. Is
yeah.
like I said,
I think Sharjah, we had this conversation before about obviously you are experiencing significant issues in terms of your symptoms and like you mentioned in this consultation, difficulty to walk and long-standing pain.
hmm
Um, but the challenge is that a scan is one type of test, one type of investigation that looks at the structure of your internal organs. And both scans have said that apart from the fatty liver and that hemorrhagic cyst on your kidneys, they couldn't find anything else. That's not to say that there isn't anything else going on and there isn't a reason for some of for the symptoms you've been experiencing. It's just saying that the MRI hasn't been able to identify it, which it can't tell you everything. And this is where we would usually rely on your GP or relevant specialists to do further tests, whether that's blood tests, endoscopies, different types of scans. So there's a whole array of things that can be done. But this test doesn't give us an answer as to what's going on with you. I think I remember last time I sent a letter to your GP about this and said, to have a discussion with you about what's going on because I don't know. I don't know what the answer is. But I don't think you'll find the answer in an MRI scan.
Okay, like I said, there's a massive cover up going on to to stick with their story and just silence the victim, and especially me doing everything I can to get my life back. What they have done to me.
Who's the culprit, like in this, in terms of cover up? Who do you think is the person who's instigating it?
Yeah, I've reported this to the police. I've done everything from my end, so you can see it's a government conspiracy, and
Yeah.
a lot of evil that they're doing everything so this doesn't get out, especially with things that I've learned on how to tackle the evil that they have unleashed on me. So you can see these scans are professionally created, and how deep this goes. A very experienced fabrication team that are experts in this, at the same time silencing my story until I give up while having all odds against me, barely any resources or support to fight back. and get my life back. So you know, all scans, all medical records from blood test, ultrasound, X-rays, MRI, CT. You know, this is where they have got caught out, where you know the radiographer mentioned lymphs, and which did not add up when you done your official report. Obviously, that was one of the major discrepancies that came from your end. Um, but like I said, I've endured more than most, and yet I'm still standing. Not because the system helped me, but because I've paved my own way forward, despite every trap set to silence me, delay, or destroy me. I'm I'm not running out of road. I'm finally close to exposing the truth. They counted on me breaking, instead I broke through. Now I need you to act, not to save me, but to stop being a part of a cover-up that harms more people than you may realize.
What the people around you in terms of the other doctors who you've spoken to, and maybe even sort of friends, family, etc. What's their perspective on what's going on with you?
Again, it's my battle, and I've done everything I can to do everything I possibly can as a normal civilian. So you can see I've gathered evidence that you know these machines and these systems that they have to do the medical scans can be altered remotely. There's loopholes written in by the manufacturers, not just it can't just be done by any hacker. This is not any hacker could manage it anyway, which points to a wider organized cover up. There's whole teams behind it, and obviously knowing how TIC Health is part of the Harley Street group, Harley Street has also been complicit in all this. You know, the Harley Street group sits at the center of private diagnostics in the UK. They
Mm.
know how these systems work. They know how they can be compromised. And yet, with all their expertise and access, they have chosen to protect the cover up. They could have given me my real medical records. They could have intervened, stopped the tampering, and helped me get my health back. But instead, they continue to delay, deflect, and deny, while I edge closer to death. If they succeed, the truth dies with me, and they walk away clean.
So, Sharjeel, like I think a lot of people, when I mean, what you're saying is obviously very, very worrying,
Hmm.
I 100% understand your
You
concern
don't know
about.
how I've what I've been through.
I guess
Again, they've done everything to silence
I
me, and
understand it.
I've
But
reported.
but I mean, a lot of people listening to this would be worried that maybe you're holding some beliefs that may not be true, or there may be some degree of paranoia. And again, I ask, has this ever been mentioned to you? Has your doctors ever spoken to you about your beliefs, and
Um,
have they suggested any further action?
of course, anyone would say that because they have not experienced, they have
Yeah.
not been on the same journey as me. Unless you understand, like maybe that's something you have never come across before.
No,
Uh,
you're right. I haven't. That's
but these things are true. These, you know, it's in front of you. I want you to, you know, maybe do some research into it. But again, there's not much out there that explains the fabrication except my story, and you know, people that it would have happened to before probably got silenced and whacked early on. But like I said, I've turned their traps into truth. They've tried to break me down at every stage, from poisoning my body to fabricating my medical records to hacking my phone, delaying treatment until I give up. But I didn't fall for their traps, they did. What they didn't count on was that through all of this, I would start to see through them, that creation itself would guide me, that every lie they told would only sharpen my vision, deepen my understanding, and prepare me to expose the system like no one has ever done before. They tried to erase me early because they knew what I could become, a voice too loud to silence. But I'm still here, and now all of creation stands behind me. The truth is no longer mine alone. It belongs to every life they have destroyed to protect their conspiracy. When it all comes out, you know, every medical record, every scan, email, and telephone log, journalists, regulators, and if need to be, the courts will see the lot of it. The people who designed and allowed the system will have to answer for it.
Charlie,
Yeah.
what effect has your issues and what's been going on had on sort of normal home life, family life? Do you have people around you? Do you have people who support you?
Uh, yeah, I've got my family around, but I've not really, I haven't shared all every. this battle with them yet. Like
Yeah.
I've done everything from my end to see if they finally give my real medical records, because as a dying mind, what else can you do? You've done so many blood tests privately with the NHS, and
Yeah.
they're sticking with that same story. You made multiple police reports, and no one has ever even contacted you within 48 hours. So that's what they're meant to do. Within 40 hours, they're supposed to contact you, but they never did once. And I made multiple of them, right? Explaining my situation. What else can a person do? Is
Yeah.
until they create chaos in your house and around you, and for you just to give up.
And how has that happened? Do you feel like there
No,
has
I've,
been
I've, I've
change?
contained their evil. I've done, I've contained the damage, that the chaos that they have sent towards me, and done everything from my end to expose the truth. Expose how they have gotten away with not just this, but so much more. Um, but
Do
again,
you,
as you can see for yourself, I've done 2 scans at TIC Health. TIC Health came up with an amazing solution with the membership and everything. So I came across it, and it kind of been a lifesaver as well, with getting this scan and seeing how this fabrication is possible in real time, and how there's a massive team behind it.
mm,
Because this, like I said, not one person, not any hacker can do this with precise images and everything.
has all of this had an effect on sort of your professional life? Do you have a regular job?
I mean, I can't work. I cannot work with the condition I'm left with. Um,
Yeah.
Most of my organs, my liver, both my kidneys are very destroyed. Where I have to hold my back while I'm walking, right? I have to hold like continuously in pain,
Yeah.
24/7. This, like I said, what they have done, how they're gonna deny it once I collapse very soon.
I remember last time you mentioned that your NHS GP had referred you to a neurologist. The waiting time was long. Has anything come from that?
Yeah, they done an ultrasound, and that ultrasound mentioned not even the kidney cyst. It mentioned nothing. Apparently everything was normal. And
Mm.
then when I done the scans with you, the kidney cyst turned into a hemorrhage. So their story didn't add up. Like I said, they got caught in their own traps, where they're doing everything to cover this up and not allow my story to get out there.
What about the urologists themselves? Have you ever had to sit in a clinic? Do they ever speak to you about what the cause of your pain could be or
But
anything like
again,
that?
no one can do much, because you guys are going by the reports that's provided to you. Meaning,
Yeah.
the scans that's provided to you, the report.
This
So
is a bit much for you.
once they get to those scans, fabricating those images and everything, then yeah, the reports will come out fake, and yeah, it's until that by now anyone would have gone insane with how they've made me go around and around. And like I said, I've had creation step in, and I've the experiences I've had in my life, it's been, yeah, it can't even be explained. You have to see it for yourself,
Yeah.
kind of thing. But it's
Did,
true, and
did you ever
this is why they have had to back off, and you know
did you experience anything like this when you were younger, like in childhood?
no, it's ever since my health started to deteriorate, and I've done everything I can from my end, you know, to go get blood tests done, not just with the NHS but privately, because I wasn't satisfied with what they were doing, and then it became them covering up everything until I lose control, until I break down, and that's it, game over for me then.
This,
Um,
this all must be pretty expensive, all of this stuff, private blood tests, private scans and stuff. Is it financially a bit of a burden for you?
exactly, like I said, I was an IT engineer before, and I've had enough funds to get this done at the start, and I've kept every record of it. Recently, I've had to, not a few months ago, I had to work at Uniqlo as a customer assistant just to save up enough while being
Yeah.
in pain as it is. Um, so again, at the moment, I'm on universal credit and just doing everything I can, because I'm unable to work. I'm doing everything I can from my end to survive. And yeah, with the amount of evidence I have, the how I've gathered every report and everything, they will soon be exposed. It's just a matter of time when um, going out to the public platform, explaining my story, my situation, and it's clear.
What's your own doctors, your own GP stance on everything right now? What do they think is going on?
It's the same thing. It's there's not much they can do. They're only going by the reports that's been provided to them.
Yeah.
But like I said, I was expecting more of an investigation, as you are part of the Harley Street group, and you know the truth is out there with the fabrication, and they have done nothing to stop this. They have continued with the cover up, but especially once a person is not satisfied with the NHS diagnostics,
Yeah.
they get done privately, and you know as you know, Harley Street is this is center of it all for the private diagnostics. So
Yeah.
if they're complicit as well, then what more can a person do?
Has anybody ever tried to explain your symptoms being in the form of like maybe some form of psychological disturbance or mental health issue? Has anyone ever spoke to you about that before?
I mean, that's what the people are gonna say, isn't it? It's if they don't know my story, if they don't know everything I've been through, they haven't been a part of my journey. But
Yeah.
again, as a doctor, you might think that, but you know, the world is big. You have to see beyond that. It can't, one person can't continuously get these scans done and everything, and find a kidney cyst turning into a hemorrhage, and then after that it will turn into cancer somehow, and just in one kidney there's no mention of the other kidney or the liver being destroyed as well. But yeah,
Yeah.
it's like I said, they got caught in their own traps, and it's a matter of time.
Yeah, I guess I have to apologize, Sharjah, that I haven't been able to give you an answer as to what's going on.
Yeah, I was looking forward to hearing back from
Yeah,
for about the lymph nodes that was mentioned to me, because that was the change that occurred
yeah,
in the scans, and the story just doesn't add up now. Uh,
yeah. You're right. You're right. It doesn't add up. As in, you can't match what you're experiencing, what we're seeing in the scan. Again, can happen sometimes, and it may need further investigation. Last time I sent a report to your GP, I didn't hear back from them. Again, I'm happy to do the same thing if you're happy, or if you give me consent to do the same thing.
I mean,
Uh,
do whatever you have to. I've mentioned to you, the GP and everyone, they cannot do much until this fabrication of my medical records stop. Whoever's behind accessing the systems, behind
yeah,
the system compromise, until that stops, and everything is done from TIC Health or wherever I get the scan done from, even NHS, until that stops. But again, if it's only when it's too late, isn't it? Uh, me, like I said, I could soon collapse with the condition I'm left with, and what they're gonna do then anyway. So we'll see.
yeah. Yeah. Time will obviously tell. I wish I had some advice for you about what the next step should be, but again, I think maybe I should talk to your NHS GP about what they think the next step should be, and hopefully there's an answer somewhere. But yeah,
I mean,
I
you should also, mention everything we discussed, the fabrication of the in detail,
yeah, I
because
mean, of course, I mean
it
your ideas and your perspective is very important to your patient management. Of course, I'll be mentioning it to your GP. I don't know whether your GP would see it the same way.
it's because if you leave parts of it, it just doesn't make sense at the end of it, because everyone is going by what they see. It's because you do this regularly for so many other clients that come through your door, and
Yeah,
some never has it, you have never experienced this, but some people are targeted, and if this is why I've had these scans done, so I can get my real, get whoever's doing the system compromise in the back end, caught this some caught with whoever's behind it, and I've done everything by reporting it to the police, doing so many scans, but the whole system is against you, so you do not expose them. So yeah, it's like I said, it's not, once I get the platform I need to share my story, everyone can see it for themselves, and we'll leave it there.
Yeah. I mean, yeah. Let's see how it goes. I mean, speak to your doctors. Hopefully, they will contact you if there's a next step that they want to explore. But I'd encourage you to speak to them as well to see if there's anything else we can do. Yeah, let's see how it goes.
Definitely. All right. Thank you very much.
No worries, Shaja. No worries. Bye bye.
Cheers.